Hello doctors, my name is Faraz from Pratima Medical College. Today's topic is Paget's disease of bone. It is also known as osteitis deformans. It is a focal disorder of bone due to which there is imbalance between osteoclast and osteoblast function. We know that osteoclasts are the cells which break down the bone and osteoblasts are the cells which helps in bone formation. Paget's disease of bone is common in older patients, that is more than 70 years of age. Let's come to etiology. There is excessive bone remodeling or bone turnover occurs due to which there is a overgrowth of bone at focal site of bone. Finally, new bone is formed which is abnormally large and deformed. Exact cause is not known, but primarily it is due to abnormal osteoclast or it may be due to viral infection. Let's come to pathogenesis. Paget's disease of bone evolves via three phases or stages. First phase is initial phase. It is also known as osteolytic phase, where osteoclasts break down the bone. Bizarre shaped numerous multinucleated cells are seen. I will show you a beautiful diagram of this Paget's disease. This is osteolytic phase. Okay, these are osteoclasts. Okay, let's come to second phase, that is mixed phase, which it is known as osteolytic osteoblastic phase, where this is how it looks like. These are osteoblasts, these are osteoclasts. New bone formation is seen. Finally, last phase is final phase. It is also known as osteosclerotic phase. New bone formation dominates. Hypervascularity of bone occurs. I will show you osteosclerotic phase. This is how osteosclerotic phase looks like. Osteoblast dominant. Weak, thickened woven bone is seen. Where we know that woven bone is nothing but due to irregular arrangement of collagen fibers, there is a large number of cell and reduced mineral content. It is also known as primary bone. So finally, at end result is thick sclerotic bone is formed that easily gets fractured. So these are phases of Paget's disease. Let's come to bone morphology. Mosaic pattern of laminar bone is seen, which is distorted. Cement lines are seen, which is not sealed. Laminar bone is nothing but it is a mature bone which is formed due to remodeling of immature woven bone. This is what bone morphology slide looks like. These are cement lines. Okay, let's come to clinical features part. Asymptomatic mostly, often affects long bones, skull and spine. Bone pain is seen due to microfractures. Bowing of legs is seen. Characteristic feature of Paget's disease is chalk stick fracture. Okay, remember this. Enlarged bone is seen and there is a increased heart size. Cranial nerve compression is seen due to which there is a deafness. Radiculopathy at spine is seen. Erythema occurs over affected bone area due to hypervascularity. There is an increased bone ALP level, alkaline phosphatase levels. So key characteristic features or clinical features what you have to remember for exams is mainly these points: chalk stick fracture, enlarged skull, cranial nerve compression due to which leads to deafness, increased bone ALP levels. This is a main thing. Okay, main findings. Let's come to treatment part. Bisphosphonates and calcitonin are given. Simple treatment. Let's come to complications part. Paget's disease of bone leads to osteosarcoma and high output cardiac failure is seen, AV fistula in new bone. This is all about Paget's disease of bone, and I will show you one image. Okay, this is a patient with Paget's disease. You can see here increased skull size, increased head size. Okay, this is another patient. Skull size is increased, bowing of legs you can see. Okay, this is how patient looks like. Always remember this picture in your brain when you study Paget's disease of bone.